My name is Maureen Busby and I'm the founder of PCOS Vitality. I set it up basically because it was born out of frustration, really, that there was a real lack of support and awareness for people with PCOS. I actually diagnosed myself by reading about my symptoms in a medical book in Waterstones. And the first time I went even to get the blood tests, I was told to come back again because Friday afternoon wasn't a good time for doing tests. And I came away, it had taken me a lot of courage to go in the first place. And I came away very disappointed and I felt dismissed. And I do wonder, was that just because it was a menstrual disorder or to do with women's health? So I eventually did get a diagnosis, and that was PCOS. But that was it. I was told on a telephone call, yes, you have PCOS. I was given no information about it. And because of the nature of the name, cysts, we often wonder, do you need them removed? Or, I had a lot of questions, and those questions were never addressed or answered. So really, I've had to always push for more answers and have to go back. And it's hard to do that too when you aren't feeling well, or you're in pain, or you're having very heavy bleeding. And when I eventually did get an appointment with the gynecologist, he had been more focused on my weight primarily. Now, I did have the classic symptoms of PCOS. So I had hyperandrogenism, so I had excess hair on my body in places where it wouldn't normally be. I also had an abdominal weight gain at that point, and I also had some acne, and I then was examined and I had cysts on the ovaries. But the sole focus was weight, and I hadn't really gained weight until the symptoms had started to show, and then I was put on the pill, and the pill just exacerbated weight gain. I developed pains in my legs, and I was aware of there's a high risk of cardiovascular disease within my own family, and there's a connection with it and PCOS. So at least I knew I needed to get off the pill because it was risky for me. But a lot of women aren't aware of this, and it is very serious. And I think because the whole disorder is just sort of looked upon as a reproductive disorder, whereas now it is actually recognized more as a lifelong metabolic condition. And I think this is where we're always focusing on it from a fertility point of view, and this is where everything's going wrong, because women are women first and mothers second. And I think we need to really step back and see, what are we doing for the individual's health, as well as, future generations. Yes, it can be passed on, but it still doesn't help the people who are suffering now with the symptoms of the condition. So after the fat shaming at the gynecologist, then I disengaged with healthcare completely and just didn't go back. This is a huge issue within the PCOS community about weight, and you're told to eat less, move more, and go on the pill. And I think a lot of women now, because there are more of us of my age, of my generation, starting to speak out, that people are starting to say, well, we've been there and we've done all of that, and it doesn't really work. There are international guidelines for PCOS, and to my knowledge, they're not even being followed. In general, we should be assessed for our diabetes and even anxiety and depression. You should be screened for these things, and in practice it doesn't appear to happen. And that's really, really, I just think that's very dismissive. We just don't seem to have been taken very seriously. I'm very lucky now that I've found a good endocrinologist, but because I find it hard to trust doctors as well now, because at different times I've been told misinformation. I mean, I was told it goes away at menopause. PCOS does not go away at menopause. I've also been told, oh, you might not have children, but 30% of women with PCOS will have no problem conceiving. And I think that's important to have that hope if that's what you want. But we do have to recognise that not everyone wants to be a mother as well. So we have to look after, everyone's health. After the fertile years, there's very little information about PCOS in relation to post-reproductive life and health. And it's like you don't matter anymore. It's all again focused too much on the fertility side of things and reproductive health, whereas I think it should be a more holistic approach to treating the disorder. The other thing I'm still shocked by, like even maybe last week or so, a woman would say to me, "What is PCOS anyway? I was just told I have it." And I'm thinking, this is 2020. I just, it's incredulous to me that this is still happening. And I do think we're missing an opportunity to prevent serious illness. And I just don't understand it. I really don't. I don't understand why it's not taken more seriously. My study focused on how we cope with PCOS at different stages of the menopausal transition, and it found that women with PCOS are concerned with the menopause from earlier on than maybe people would think, because it is a focus of the end of reproductive life, and because of the fact that we sometimes don't have periods because of or no ovulation as well. There are times when some women have thought that they might be in early menopause, and again, no one can answer this for them about, when is the menopause for you, and we all expect it to be different because our hormonal systems are working in a different way. So, when do we know when to expect the menopause? I personally have asked about being in menopause, and no one's been able to answer that for me. And again, the issues came up again in my study, and it really was lack of information and confusion, and that was in relation to the different advice that people were given. So contradictory advice at times, and again told that it's gone away, and it hadn't, of course. So there's a lot of inaccurate information being given out to people. The other thing, that there was a bit of stigma in relation to weight, and women described the feeling of being lost. So then and there's a tendency then to go then into trying to help yourself. So people would use the internet a lot, and then of course there are dangers involved with using non-evidence-based advice. There is a need perhaps for more education for GPs on women's health, just in itself, and like with other conditions as well. And I know there's a big push at the moment for education on menopause, but PCOS is lifelong. To me, why is it not being prioritized? And it's actually a public health issue as well, in terms of the diabetes and obesity. Now there is a problem, I think, between translating the research into practice. Today I try to manage my weight. I do pay a big attention to that. It is difficult, but I sort of come to accept that I'm not going to be a normal BMI. It's just not something, it's not a goal that is achievable for me. I've accepted that. And I think even a lot of times, we are set unobtainable goals with regards to weight. And so, finding some sort of self-acceptance is a good thing, a positive thing for your mental health. I exercise a lot. I would exercise every day. I do walking a lot. Walking, I find, is great. And I try to manage stress a lot more now, to try and minimize it, because it has a negative effect. And just having good support, your family and friends, and Also the support of the others within the PCOS community. There's a crowd of us now have been helping each other for years, and it's good to have, you know, someone to turn to and talk to about it that really understands it. I've had laser hair removal. That was one of the key things I think that really helped me, especially with your body image. I think my advice is to not give up when you get a doctor that doesn't seem to understand or know. I think I call it the revolving door of PCOS. You know, you go in and you tell them all your history, and if you get anywhere, that's great. Go back and see them. But if not, just go back. I just came to a stage in life where I just thought, right, well, they don't know. It's not my fault. I'm going back. So just kept going to different doctors until I eventually get what I needed to try out. And I think that's the thing. You know, everyone deserves good health care. And I think because of the weight issues that a lot of women with PCOS feel they're to blame for the disease, and you're not. I mean, you didn't cause this. It's mostly, you know, there are a lot of factors involved, but a lot of it is down to genetics. And I would always say to people, you know, get in touch with us and look at our website, and we have lots of free information for you, but realize that it's not your own fault and that you should seek help early and don't take no for an answer. And, you know, don't give up on yourself. You deserve the very best of healthcare.